Hello and welcome everyone, and thank you for joining us this evening for the My IBD Learning webinar series. Today's webinar will be focused on transitioning through the stages of IBD care, and we will discuss common issues and challenges that teens and young adults may face as they transition through the stages of IBD care and into adulthood, the stages of transition and phases of self-management, and the resources available for young IBD patients. My name is Adam Cook, and I'm a senior at Drake University in Iowa, and I'm the co-chair of the Crohn's and Colitis Foundation's National Council of College Leaders, also known as NCCL. I am pleased to be facilitating tonight's program. The My IBD Learning webinar series features different educational topics throughout the year. We invite you to view the Foundation's upcoming My IBD Learning webinars and in-person regional events at crohnscolitisfoundation.org/myibdlearning. A few housekeeping reminders before we begin. This program will be recorded and accessible to view after the completion of tonight's program. If you have questions for our presenters during tonight's program, please enter them in the Q&A box. We will try to get to as many as possible. If you're interested in the live closed captioning, there are two ways you can access it: by clicking on the CC button on the bottom and by clicking on Show Subtitles. If you don't see that option, then you may need to download the latest version of Zoom. Now, I would like to introduce this evening's expert and panelists who you will be hearing from tonight. Dr. Hilary Michael is a pediatric gastroenterologist at Nationwide Children's Hospital in Columbus, Ohio, who focuses on the care of children and adolescents with inflammatory bowel disease. Her clinical and research interests focus on the comprehensive care delivery, patient and family engagement, and medical research. Her medical research interests focus on comprehensive care, delivery, patients, and family medical care, and optimizing transitions from pediatric to adult care. She's also passionate about educating the next generation of physicians to provide patient-centered, multidisciplinary care. We will also be hearing from some of my fellow members from the Foundation's NCCL. The NCCL works with the Foundation to increase awareness of IBD through youth-focused advocacy, education, and fundraising. I am pleased to welcome Aliyah Deschmidt, a senior at the University of Washington, Anna Noto, a sophomore at the University of the Pacific, and Rahm Stern, a junior at Boston University. Thank you all for being here today. At this time, I'm going to pass it over to Dr. Michael, who will be discussing the ages and stages of IBD care.
Thank you so much, Adam, for that wonderful introduction. And let me get these slides up for everyone. I am thrilled to be here tonight. As Adam said, my name is Hilary Michael. I'm a pediatric gastroenterologist at Nationwide Children's in Columbus, Ohio. I'm grateful to the NCCL and to the Crohn's and Colitis Foundation for inviting me to be with you all tonight. And I'm really excited to share some things with all of you and also to learn from our fantastic NCCL leaders later in the talk. So this slide here just says that this is an educational event and reminds you that it doesn't replace a conversation with your healthcare team. And before we dig in, I have no disclosures to share. So by the end of my chunk of tonight's session, we hopefully will review all of these objectives. We will review the pediatric IBD journey. We'll define some important terms: self-management, transition, and transfer. We'll talk about some known barriers to a successful transition and transfer. We will highlight the differences between pediatric and adult care. And then there will be some tips for all, parents, patients, family members alike, to help make the smoothest transition and transfer possible, and ultimately help our young folks have the best outcomes. So I wanted to start with this because it to me represents the pediatric IBD journey, a series of interwinding roads with different on-ramps and different off-ramps. And I know I'm preaching to the choir here when I say that everybody has a different journey, a different IBD journey. Some folks get on earlier in life, 2-3 years old. Some folks, their on-ramp is a little later. Some folks on-ramp is right before they're about to leave for college or get their first job. And then similarly, if you think of the off-ramp as the time where you transition from pediatric to adult care and go over to an adult doc and an adult healthcare system, that off-ramp may be at a slightly different time as well. And I like to think of pediatric IBD as a journey, and that preparation from going from pediatric to adult care as a journey, because it's kind of like a road trip. When you get onto the journey, you might have a different set of folks with you, a different set of people in the car with you. You might have a trunk that's full of resources and tools and skills, and you're ready to roll. Or you might have gotten into that car not really knowing what you were getting into, not having the supplies. And so throughout your road trip, we're here, your providers, the NCCL members, the Crohn's and Colitis Foundation, to kind of make sure your trunk is well stocked, make sure that you're ready for the journey, and that ultimately when you get off at that adult stop, that you're ready to roll, that you're ready to thrive. And the you there that I'm referring to includes patients, includes families, includes parents, because we know that this is a whole family journey as well. And so that will lead us to a couple important definitions to navigate through tonight's talk: self-management, transition, and transfer. So to start with self-management is the knowledge and the skills that are needed to live well with a chronic condition. And so if you think about self-management knowledge, for a patient with IBD, this might be, what is IBD? Where is my IBD located in my body? What are my symptoms? What medicines am I on, or dietary treatments am I on? And why do I take them? In terms of skills, the first little calendar there is meant to represent, can I make my own appointments? Can I call and refill my medications? If I'm on a dietary therapy for my IBD, can I go to the grocery store and shop? Can I make my food? And those little speech bubbles at the bottom are super, super important, something I'm really passionate about. Can I communicate well with my healthcare team? Can I voice my opinions? Can I share my thoughts? Can I ask questions? All of these things are self-management knowledge and skills that we want to help young people develop as they navigate their IBD journey and then ultimately get off at that adult care exit. And so if you are anything like many of the patients and families that I see in the office and that I've talked to in my journey as an IBD doc, you might be feeling like this. That's a lot of skills, that's a lot of knowledge that either me as a patient, I'll need to know by the time I go to an adult provider, or as a parent or caregiver, wow, is my child going to be ready for that? Are they going to be able to do and know all of those things? And we have 4 amazing examples of folks who have made it and are doing it. So they're going to share their stories too. But the goal of tonight is to help give little baby steps that will get you ready, or will get your child ready for that change. And the answer is absolutely yes, we will get them ready. So that gets us into the definition of the word transition. And so transition of care is a process. And the fancy long definition is the purposeful planned movement of adolescents and young adults with chronic medical conditions from a child-centered to an adult-centered healthcare system. And the goal of transition, again, is not to go from point A to point B on that long map down there, but is to gradually navigate the path between point A and point B to allow young people to get the knowledge and the skills they need, and also to build confidence and to get them empowered so that when they get to point B, they're going to be ready. And that readiness is for the single act of transfer. So if you hear of transfer of care, that means the actual official move from pediatric to adult care. And why do we care about all these things? Why do we focus on self-management? Why are we talking about transition and transfer? Well, it's good news, and that's the good news that children with IBD all become adults with IBD. It's a wonderful success of our medical system. And we know that this leap is going to have to happen. So let's think about it early and let's get ready together. And we also know that if we don't do as good of a job as we could preparing young folks for transition and transfer, or ultimately for transfer to adult care, that time right after you get into adult care is a higher risk period for that young person and for their IBD. So we know that if we don't plan well and don't prep well, and when I say we, I mean, the healthcare system supporting you, patients and families, that young folks with IBD can have poor disease control, more flares of their IBD. They might have gaps in their care. gaps between seeing a pediatric provider and an adult provider. They are at risk for having more healthcare visits, decreased satisfaction with their care, and decreased quality of life. But the good news is that we have opportunities to prevent or decrease the riskiness of that period by getting started early. And so with that, the goals of a smooth, streamlined transition and transfer, a well-prepared journey where the car is packed with snacks and maps, and your Google Maps is on your phone and your phone is charged. If we have a good, smooth transition and transfer, we're going to be able to provide age-appropriate care. So when a child is 7, they're going to need different care than when they're 10, than when they're 17, than when they're 22. We're going to prevent those gaps and provide uninterrupted care from the pediatric to the adult world. We're going to coordinate that care. So this is the job of medical systems and medical providers, is we're going to make sure that there's a nice handoff from me to the adult doc who's seeing you, that there's no kind of unanswered questions or information that's lost in the translation between pediatrics and adult care. And then ideally, it's a planned transfer. So we've talked about this before the move. There are no surprises. In a perfect world, the patient is feeling good. They're on a stable treatment regimen. They're confident. They're ready to roll. They have the skills that they need to be successful. So that's what we're working toward. But, and then in the end, sorry, I forgot my little bubble there. Ultimately, we're working toward optimized health and well-being. We want every single patient to move into their adult life, the adult portion of their journey, healthy and living the life that any young adult wants to live. So that's what we're working toward together. But we also acknowledge that change is hard. And that's probably why many of you are on this call tonight, as you're thinking about these ages and stages. You're thinking about maybe that move to adult care and you're having some feelings. And I get that. So I'll start at the bottom of that circle there. As a pediatric provider, I also get nervous and have feelings about transitioning and transferring my patients. I really care about my patients, and I know my fellow pediatric GIs do, and pediatric gastroenterology teams really care about their pediatric patients, and we love you and we don't want you to go away, even though it's the right thing to do. Patients might be worried too, and I'm sure some of our collegiate leaders will tell us about their experiences, but what's it going to be like in the adult world? I know my pediatric doc, I know my pediatric team. What's that going to be like? Is it going to be different or unexpected? Parents and families may be worried if their child is ready, if they're ready to fly on their own and take on the responsibility. And adult docs also have to realize that taking care of a young person who is diagnosed as a child is different than taking care of someone who's diagnosed when they're 30, right? They had a part of their life where their parent helped take care of them or their family helped take care of them. And they have to provide some special support there too, to that young person to help them thrive. We know a few other barriers out there, and these are not to scare you, but really just to inform you, to a successful transition and transfer are things like active disease. If someone doesn't feel good, it's hard to make that move from pediatrics to adult care. If they have a more complicated medical plan, if they have other medical problems in addition to their IBD, maybe if they're struggling with some mental health challenges. Additionally, some folks, there's a lot of logistics to navigating healthcare, insurance, co-pays, all that jazz. That can be a barrier to a successful transition and transfer. We realize that IBD doesn't exist in a bubble, right? And that patients and families may be dealing with other challenges in their social life or in their family circle that make moving from a pediatric doc to an adult doc challenging. And then financial issues always. This is a time of transition from regular high school perhaps to a job, or high school to a college setting. And we know that finances can play a role as well. And then quickly, before we get into the meaty part, which you're probably all waiting for, which is, okay, I get that this is a process, but what can I do to make it smoother? I just want to highlight a few things that may be seen as barriers, but can also be enormous strengths. And that's that pediatric and adult care or adult medicine can be different. So as many of you have likely seen, pediatric care can, or ideally is family-centered. It's multidisciplinary, meaning that many folks may have access to not only GI docs and nurse practitioners, but also social workers, psychologists, dietitians, child life specialists. And in general, the parent or the other caregivers, the family, are the primary decision makers, and maybe the child or the patient is kind of a bit in the backseat. In some scenarios, you may notice that there's a bit less of a focus on growing independence and more on kind of the family structure. Now, in adult care, things may be a little bit different. It tends to be more patient-centered. There's a lot more focus on autonomy of the patient. That person is being independent. That person is kind of the center of their care. Now, that may imply that pediatric care is better, which is not what I'm saying. I actually think that there are really wonderful strengths of adult care, bonuses of adult care, that we as pediatricians aren't as good at. So for example, our adult colleagues are much better at thinking about and navigating adult relationships, romantic relationships, marriage, having children. These are things that we as pediatricians are not as good at taking care of. Adult docs are also much better ready to think about the complications of IBD that tend to affect adults more than kids, more adulty health issues that come up, elevated blood pressure, chest pain, things that we as pediatricians don't have the experience caring for that adult providers do. Pregnancy, another reason that we like our adult providers to help us out. And in a potentially negative side, there may be a little bit more or less of a focus on the family's concerns because the adult docs really want to focus on the patient's concerns. And so now we know that there is a journey. We've learned about the process of transition, that journey together in the car. We've learned about the ultimate move, the transfer of care to the adult world. And so I wanted to just leave by sharing a few tips for all involved on ways we can work together to plan the best trip possible and set our young folks up for success. And so my first tip would be to break this up into stages. Everyone knows that going on a long road trip is never fun if you don't have pit stops and you can't use the bathroom, right? This is also an IBD talk, so we have to mention the pit stops. So this is just an example of how you might break down the skills, the self-management skills and knowledge by age groups. So maybe if you or your child is 6 to 11, you might have a goal of knowing that you have IBD, knowing the symptoms that it causes, and knowing when to speak up, when to tell your parent or your doctor or whomever that you're not feeling well. And then in the next stage, you might have a better understanding of what is IBD, what causes it, where is my IBD in my intestines, what are my meds? The next step up then is that you, by the time you're 15 or 16, you are comfortable talking to your medical team, you know your medicine side effects, you can take your medicines or are starting to take medicines without reminders from your parent or your family, or you can even get onto your health record. You might have MyChart or some other patient portal and you can start messaging your doctors and your healthcare teams. And then in that final stage, right before you take the leap to adult care, I might challenge you to carry your insurance card, to set your own appointments, or to start practicing refilling your meds. So again, no one expects you to go from the start to the end with no preparation and practice. It really is a stepwise approach. And I wanted to highlight here up at the top, Camp Oasis. So Camp Oasis is a great Crohn's and Colitis Foundation program, a camp for kids with IBD and teens with IBD, where you have kind of a safe space to practice some of these knowledge and skill building activities amongst your peers. So I just wanted to put a plug in for that. Here's one other quick way to think about the phases of transition. So, phase one might be that your pediatric doctor introduces the concept of transition and talks about how the expectations and responsibilities will shift over time. And then, so you're kind of planting the seed. Phase two is that the young adult starts gaining the knowledge they need and the skills they need to take care of their own medical care, and the parents start taking a step back. And then phase 3 is when the adult doc takes over and that young adult patient is ready to take over their self-management solo, certainly with parents and family in the background providing support too. And so I'll wrap up with just a few very concrete ideas for ways that parent and caregivers can help, and then the way that patients can help. And then I'm gonna tell you some ways that we as providers should be doing as best of a job as we can to help you on this journey. And so here are some ideas. Allowing your young person to spend some time alone with their healthcare providers can be super important. That is a very important step to gradually giving them more responsibility to have conversations, to ask questions, to advocate for themselves. I also think that it can be really helpful if parents and caregivers support your young person in building your knowledge and skills. Help your young person seek out those Crohn's and Colitis Foundation resources, review materials together, maybe do little reading assignments and then discuss later. When you're getting closer to transfer of care, young people can benefit from you helping them find an adult provider. And this is something that we as pediatric providers can help with too. You can help them gather their medical records. And in the end, I think that young adult patients really benefit from you being their biggest fan, being their cheerleader, remembering their successes, and then bringing those up. And then one thing that I would recommend is focusing on interdependence first. So patients and families working together first before independence. And then very quickly, patients, you can help by listening and participating during your visits, trying to put the phone down and being engaged, working with your healthcare providers and your parents and family to set some mini goals. And there are some examples of mini goals you can try. Seeking out information. So if you have a question, send a MyChart message to your doc or look on Crohn's and colitis and see if you can find the answer. And then make it easier for yourself to do the right thing. Set reminders in your phone to take your meds. Keep your insurance card in your wallet. These are just some ideas of ways you can take steps to getting ready. And then lastly, I'll fly through these. I know this webinar is focused on patients and families getting ready, but hold your healthcare providers accountable. Your healthcare provider should be allowing you to feel comfortable, should listen to you attentively, should encourage your successes, challenge you to your next stages of responsibility, understand what's important to you, ask you how IBD is affecting your life, and really just be a partner in your care. So these slides will be available for your reference later, but I just want to make sure that you know that we are here for you, to support you and to help you on your journey. And so in summary, pediatric IBD is a journey. No one's journey is the same. We know change is hard. It's hard for us too. So thinking ahead and preparing can help. We absolutely want to empower kids and young adults to be involved in their care at every stage. There's no age that is too young to be involved in. Everyone can play a role, patients, families, parents, docs, all the above, in making it the best trip possible. And last but not least, support is there in the IBD community, in the Crohn's and Colitis Foundation. So please don't be afraid to ask for help. And with that, I will hand it back over to Adam for more ways to make this journey less like the picture on the left, more like the picture on the right. And I appreciate all of your time having me here today with you.
Thank you so much, Dr. Michael, for that informative presentation. Now we will hear from myself and other members of the Foundation's National Council of College Leaders about their personal experiences navigating the transition from pediatric to adult care. We will hear from Aliyah Deschmidt, who will discuss self-advocacy as an IBD patient, Rahm Stern, who will discuss navigating IBD as a college student, and Anna Noto, who will discuss navigating the parent-child relationship while transitioning through the stages of care. Then I'll share my experiences navigating care while studying abroad. With that, Aliyah, I'll pass it over to you.
Thank you, Adam. Hi, everyone. Like Adam said, my name is Aliyah Deschmidt. I'm 23 years old. I'm doing the last year of my master's degree at the University of Washington in Seattle. I've had Crohn's disease since I was 14, and I transitioned to an adult GI 2 years ago. So managing your care is kind of a full-time job, one that our parents have been doing for us for quite a while in some cases. And as we transition to managing our own care, it's important that we understand all that it entails so that our standard of care and our health are not negatively impacted. Managing your own care can look like scheduling doctor's appointments, procedures, tests, communicating with your insurance, refilling and picking up medications, reaching out to your doctors with questions, and keeping track of how you're feeling. And then also advocating for yourself can look like convincing your doctor that you don't feel well and that they need to run additional tests or try a different treatment when they say that you are fine. Advocating for yourself can also look like speaking with your professors or your job managers to kind of ensure that you're getting the accommodations that you need and are entitled to. And most importantly, advocating for yourself looks like knowing your own body, your own needs, and your own limits, and making sure that the people around you, including yourself, respect them. So for me, the hardest part of managing my own care has been scheduling. It's really on us to make all the appointments, and doctors are busy people. If you wait too long to make that phone call or send that MyChart message, you're going to end up with an appointment months later than you wanted, or having to call every morning to check if there's a cancellation to fit you in sooner. I have one doctor that won't renew my prescriptions until they see me in person, and I always struggle to remember to schedule that appointment far enough in advance that I see them in time before my prescription expires. As you can see, I'm not perfect at this yet. I'm always still improving, and it's something we can constantly be working on. In terms of advocating for myself, when I first applied for disability accommodations at my college, they actually rejected me. And they said that I hadn't provided enough proof that the accommodations I requested were even necessary. I had to go and advocate for myself, meeting with their staff to describe the importance of these accommodations for my success in college. At the doctor's office, I advocate for myself by making sure my voice and opinion is heard. Recently, I've been having a lot of problems with nutritional deficiencies that I don't normally have, but my blood work and other tests have come back normal. So I've been advocating for myself, making sure that my doctors are running additional tests and really listening to my needs so that we can figure out what's going on. I also have to advocate for myself by drawing boundaries in terms of what side effects I'm willing to put up with and which ones are deal breakers. This can also be seen in terms of administering medication. So maybe, an infusion schedule for a specific medication just isn't going to work for your lifestyle, and that's okay. That's something that you want to know about yourself and communicate that to your doctors and really advocate for one that'll fit your needs. I had this one biologic that I was using that I really liked. It was actually the first medication that was able to get me into remission, but it caused a lot of side effects, including joint pain and irritating skin rashes. And at that time in my life, those were unacceptable to me as a very active high schooler. And so we had that conversation with my doctor about moving off of that medication, even though it was working for me. And with insurance, I advocate for myself constantly by communicating with them about issues and questions I have with my coverage. Sometimes it's calling to get updates on prior authorizations, starting an appeal for denied coverage, and so much more. I recently had to call them to ask why they refused to cover one of my medications and found out it was because they had switched to only covering medications filled in 90-day supplies. My doctor had sent over a prescription with only a 30-day supply. And this meant I had to call my doctor to get them to reissue a new prescription and then call the pharmacy to make sure that the 90-day one was the one being filled. But because I was able to call insurance instead of just paying for that medication initially, assuming that insurance had rejected it for a good reason, I was able to solve the issue and get the medication covered. And just to kind of, wrap up, you're really the person who knows your body and your illness and your needs the most. And you really need to advocate for yourself to make sure you're getting the support that you need. And you deserve and are legally entitled to all of these supports. And so I really want to make sure that you're able to go out and get them. Don't let others, like your insurance, your job, your school, or even your doctor, if they don't listen to your input. Try to take control over how you manage your life and disease. And now I'm going to pass it to Rahm to talk about how to navigate your IBD care in college.
Hello all, thanks for joining us today. My name is Rahm Stern. I'm 20 years old and I'm a sophomore studying biology and public health at Boston University. And I'm from St. Louis, but yeah, I'll just get into my IBD story a bit. I got diagnosed when I was in the middle of high school. I initially did not think much of IBD as a healthy 16, 17-year-old playing sports and just being normal. I really didn't think much of it until a couple months in when I realized it was really not a joke. At the worst, I was using the restroom a bunch, in horrible pain, on bed rest in the hospital, and I lost about 60 pounds. And so I was not in school at all. And so I was hardly living a normal life for the first year and a half. And at this point in my IBD journey, I transitioned to adult GI. And so I went to my first adult GI appointment right at my 18th birthday, so right away, especially because I ran out of treatment options when I was in pediatrics. And so I got sent over to adult GI. And changing to adult GI was a blessing and a curse at the same time. By going over to adult GI, I was able to get on medications that I couldn't have in pediatrics. And these are the medications that I'm on today and are making me feel much better. But however, I had to leave a community in place that I felt like a second home in pediatrics. I spent so much time at my local children's hospital as an inpatient, getting procedures, infusions, going to appointments, and just spent a lot of time there. And pediatrics was just so much more homey than adult GI. Not that my adult GI was scary, but just pediatrics was just so much more colorful. Everybody would take infinite extra steps to make sure you felt fine at all the time. And yeah, just walking into a hospital, a children's hospital, it's just a vibrant environment. And there's like things like giraffes on the wall. And even as an 18-year-old, it made me feel comforted, especially when I felt really sick. But in adult GI, it's a lot more efficient. They get the job done, but it definitely is a huge step from pediatrics. And now after 2 years, I've definitely gotten accustomed to adult GI and I'm more comfortable. And I've really just gotten used to making medical decisions for myself and asking questions that I'm concerned about, which I feel like is a huge step from pediatrics because you really have to go out of your way to ask questions and concerns that you want to get addressed. But after this change, it was in my IBD journey, it was 2020, the COVID year. And so I was back at home and I was online for school. And so this past fall was really the first time I was really trying to function in a normal society in over 3 years after really bad IBD flares and COVID. And so, I feel like this past school year has been my greatest learning experience with IBD, especially being in a new place without my parents. And I've been doing much better overall health-wise since my initial flare. But this past year, I've still had periods of flares. And even when I'm in remission, there's been a lot of things that have not gone my way. And I feel like a common misconception is that when you're in remission, you're 100% back to normal health. And I feel like, at least in my case, that was not the case, with my bowels still not acting normally. I still need to make conscientious effort to stay healthy by properly eating, sleeping, and exercising. And then I'm still on a lot of medications. And so that comes with a lot of side effects. And so last semester, I really took, at the beginning of my back to normal year for me, I took a very difficult course load that I would have managed pre-IBD, but I soon found out that just because I was not bedridden and very sick with IBD really still impacted all my aspects of my life. And so having to take care of myself, my illness, and be on top of schoolwork, and then play sport as well was just very tolling on my body. And especially because I pushed health to a lesser priority, I was just a big mess last semester. And so I guess taking responsibility for my own health is probably the biggest difference from when I was at home to now. And I don't have my parents to support me in any way I need. So I've had to really change a lot of things as I've been learning throughout this year. And I guess I found out that this semester, I've had to really tailor my diet, my sleep schedule, and almost everything in my life, including when I hang out with my friends and stuff, just around my IBD, and having my IBD as my biggest priority. And I used to be a very poor sleeper. I never thought about sleep to be a thing that would ever help me in any way possible. But I have learned that sleep is a huge thing. And by making an effort to get enough sleep, even over school sometimes, it has really helped me in just in any way possible. And yeah, I guess by doing this, I'm just living a more stress-free lifestyle, even when I'm in a flare, and just listening to my own body instead of just ignoring it and carrying out with my normal commitments. I've been able to control everything a little better. And so at the end of the day, Like, I think everybody's disease impacts them differently. So definitely do whatever's right for you, and work with your support system, like your family, your friends, and doctors. And just overall taking care of your health as your first priority may suck, but just listening to what your body wants instead of what you want will definitely help make this transition easier. And so, yeah. And then I'll pass it over to Anna. Thank you.
Thanks, Rahm. Hi, everyone. My name is Anna Noto, and I'm from New York, and I'm in my second year of college in California. I just turned 20 last week. I was diagnosed at 16, but I'd been showing symptoms since I was 5 years old. And as of right now, I've never reached remission. I have not yet made the transition, and I'm still in pediatrics. So I want to start off by saying that asking for help is a strength and not a weakness. This is actually one way you can advocate for yourself. Wanting your parents involved does not make you any less of an adult. And it's important to remember that everyone's different and ready for different things at different times. Keep in mind that most people with IBD have more than just IBD going on. That piles up. It can become a lot. You may also want different levels of family involvement depending on your health at that given moment. So you might be more independent at one point, but then go into a really bad flare and need a little more help again, like you did in the past, and that's okay. One thing that I do as a young adult is make sure that my doctor appointments involve a 3-person conversation. It's not just a parent and a doctor conversation. It's not just a patient and a doctor conversation. It's all 3 of us speaking together as a group. And if you don't want your parents involved in the conversation too much, it can still help to ask them to come into appointments to just be another set of ears. And maybe they could take some notes in case you miss any important information. We get a lot thrown at us in a short amount of time. But sometimes it comes down to how much your parents are legally allowed to be involved. So my family and I had a real wake-up call when I broke my arm while away at school. My body was in shock, so I was really out of it, and the hospital wasn't allowed to talk to my mom because HIPAA. And because I'm still at a children's hospital at home, we had never had an issue with my mom getting information. We then had to ask ourselves, what would we do if it was my IBD that landed in my hospital? It landed me in the hospital while I was away from home. So ultimately, I made the decision to make an advance directive and name my mom my healthcare proxy and power of attorney. It gives my mom the legal ability to be involved in, but we still have an understanding that I have the final say. She could give me her opinions, and she has power, but she knows I still get the final say. For us, the main concern was making sure my mom would be able to call the hospital and get information or talk to a doctor if something happened and she wasn't with me. But the forms can help in other ways as well. When you have issues with fatigue and energy levels like many IBD patients do, you can't always get as much done in one day as a healthy person can. Some of you may have heard of the spoon theory, kind of like that. Sometimes it comes down to a choice between, do I have enough energy to do my homework or make a bunch of phone calls regarding something like doctors or insurance, or even go to class or call my doctor. Sometimes it really does come down to that. But the healthcare proxy and power of attorney forms allow me to be able to ask my mom for help and to ask her to make a phone call for me. So overall, just remember that no young adult is the same, and transition at your own pace. I'm going to pass it back to Adam. Thank you.
All right, thank you to all of our NCCL panelists, and I will round us out with a bit of my story, as well as talking about studying or traveling abroad while having IBD. So initially, I chose my school of Drake University in Des Moines, Iowa, because honestly, a lot part of it was close to home. For me and my family, we were very worried that if I were to go too far away from home, unlike Anna, who went across the country, there would be some sort of thing that would happen with my health, and my parents wanted to be close to me. So I never would have thought that I would even be able to travel out of the country, much less actually be able to study abroad. So this year I was able to take my January term to study abroad in London, England, studying theater history, which was a super fun experience, and I highly recommend it. But the most important thing I did was talk to my doctor about, is it safe to travel to this specific location? And especially with COVID being a concern, being immunocompromised, that's an additional concern. But if I were to need to have any sort of infusions or any sort of additional treatment, letting my GI know that I would be in a different country. It was very important for me to have that conversation very far in advance. Unfortunately, we were able to work out that it was going to be safe for me to travel. It was going to be fine for me. In fact, my doctor was much more confident and secure about it than my parents, which I think just kind of shows you how much my parents love me and want to make sure that I'm safe, but also shows that it is extremely possible for people with IBD, especially young people with IBD, to travel and to study abroad. I was only there for about a month. However, it's much more popular within universities to study abroad for an entire semester. So fortunately, I did not need to worry about getting my infusion while abroad. However, it is definitely possible in other countries. So something that I did, regardless of whether I was going to be there for just a month or the entire semester, was looking to see if my type of medication, my type of biologic, is legally accessible in that country. Fortunately, if you travel or if you live or if you study in a European country, there's a lot of similar different legal access because of the European Union's rules. So really making sure that you're able to take your medicine there legally and you're able to access it there, that's very important. That's step number one. Step number two, you gotta make sure to go in and speak with your doctor because they're the expert on it. They know whether it's safe for you to travel, if your Crohn's or colitis or other IBD is stable enough to be able to travel or to live abroad, and if they may or may not have contacts with other GIs in the area, because obviously you're gonna wanna have some point of care and some reference when you are traveling or studying abroad, if an emergency happens, or even just for your day-to-day or week-to-week care. Another important aspect of it is the financial aspect. So for insurance, if you're studying abroad, typically your university will have some sort of partnership program to make sure that your insurance is covered when you are abroad. That was the case for me. And I know that's a case for a lot of other individuals who do study abroad. However, if you are moving abroad or if you're doing something where you may not have the same insurance, what would be very important is to look into what insurance that company or that country provides. More likely than not, actually, it may be less expensive to get your medication in another country if they have a different type of healthcare system than we do. So doing some research into that and making sure that you understand how the insurance is going to be processed, or even if you have to pay it at all, is extremely important. And even if you're just traveling for a little bit like I did, or you're going to be there for a while, make sure to figure out with your insurance company here domestically what your plans are. So for me, I ended up having to go a week beyond my infusion, which was a bit scary for me, being in a whole nother country, not feeling super well. And the unfortunate part of that was I only talked to my doctor and scheduled my infusion 6 months before I left. And I know that sounds like a very long time in advance, but if you have an infusion every other month, that's really only 2 or 3 infusions you can plan around. And the insurance company was kind of tricky about exactly which dates you can select just because of their policies. So even if you're just going to be traveling for a little bit, or if you're going to be gone for an extended period like I was, and you still plan on just doing your regular infusions at home, but having travel or study abroad in the interim, really make sure that you're looking at it 8 months to a year beforehand, because you want to make sure that you get all the medication you need, you feel comfortable, and you feel confident. The one last thing I do want to reiterate is just that it is possible to travel and to study abroad as a patient with IBD. I never thought I'd be able to do it, but I was able to do it. And there are many other young IBD patients who've had success being able to explore the world and looking at spaces outside their own community. So I highly encourage it, and highly encourage any young person to at least look into the possibility and check with their doctor. All right, so with that, thank you all so much for sharing your stories. Now I'd like to invite all of our experts and panelists to join us, and we can take questions from the audience. As a reminder, please submit your questions through the Q&A box, and we will try to get to as many as possible. So it looks like our first question is for Dr. Michael. And this may differ from state to state, but do college students transfer care, or do they stay with their pediatric provider while in school?
So I think you're exactly right, Adam. The overarching answer is that it generally varies. And so I would encourage every patient and parent to talk to your pediatric provider and ask them what their general policies are. But I can say, personally, much like Anna highlighted, actually, I love that we have some folks who are still with their pediatric docs and some folks who have transferred to adult care. Generally, it's a shared decision that is focused on the patient, him or herself. So what's best for that person? I have had patients who turn 18 and for insurance reasons, they have to shift to an adult doc, or they turn 18 and they're moving to California and they're never coming back. Well, it doesn't make so much sense for them to stay with me in Ohio if they're gonna go there and stay forever. Maybe they get their first adult job right out of high school. And so they're kind of starting their official full adult life, if you will, or they are getting married or they're having a child. Then I might encourage them, an adult doc might be a better fit. But long story short, it is a personal decision that I like to make kind of hand in hand with patients and families that will fit the need of the individual patient.
Thank you. And then actually we have a follow-up to that question as well. And again, this may differ patient by patient or more specifically state to state. But generally, what ages are patients considered still pediatric?
Yeah, I think it's a great question. I mean, truly, I don't know if there's a firm answer because we know that teen pediatricians take care of little ones from the day they're born until well into their lower to mid 20s, especially young folks with chronic diseases like IBD. So I don't know if there's a hard cut point. I guess legally it's 18. Like who highlighted this? Anna highlighted it beautifully. That in the eyes of the law, when you are 18, you are an adult. But I would say in the eyes of most parents and families and even young folks, you're still a young adult when you're 18. And so as we support our young folks as late teenagers into their early 20s, I think it's still really important that we know that you're still developing, that you're still learning skills. So that there's that important dichotomy of legally versus reality, and the ways that affects both care and medical decisions, access to medical records, like Anna highlighted. I hope that answered that question.
Yes, thank you. So our next question is targeted towards us college students here. And we can start off with Anna, but how do you manage your treatments while in college? Do you get treatment near school or do you have to travel?
Okay, so like I said, I'm from New York and I go to school in California. Part of the reason I go to school in California was because a lot of people didn't think I could do it because of my IBD. So my mom and I made it work. I come home every 6 weeks for infusions because it financially makes sense insurance wise, which sounds insane. I'm aware because it is. So this Thursday, actually, I get on a plane. It's an overnight flight. I land in New York on Friday, get an infusion, take a day to sleep all day, and then get right back on the plane and get to school and go to school on Monday. That's what I've been doing every 6 weeks for pretty much the whole school year, because last year we were closed because of COVID. So yeah, it's a lot. It takes a lot out of me. But it's how I'm able. It was a way that I could still do everything I want to do. And this time we ended up pushing it because I didn't want to miss a school event. So now I don't feel great, but to me it was worth it. So it comes down to things like that. But yeah, I go back and forth.
Thank you, Anna. Aliyah, do you have a similar situation, a different situation?
Yeah, so unlike Anna, I ended up going to college quite near to where my parents live, about an hour away. And my pediatric GI is actually closer to my college campus than it was to where my parents live. So I kept my pediatric GI. I was able to get my infusions there, but it definitely informed where I switched to my adult GI. I'm my adult GI is works in my university hospital. And so it's very convenient and close for me because, you know, a lot of college students don't have cars. I found it very difficult to kind of get to my pediatric GI, even though it was much closer, just because I didn't have the benefit of my parents' car. So I think it definitely informed my decision of which adult GI to go to, you know, kind of the proximity of it, just because it makes it so much easier if you have to go, you know, regularly to get these infusions. It just makes sense. It made sense for me. And my pediatric GI allowed me to stay till I was 21. So I was able to do it for the first 2 years of college, but then it was a hard stop at age 21. So I switched to my adult GI at that point, but because they are close together, you know, they were able to call each other, transfer all the documents. So I thought it worked out well, but I think it is a very kind of decision that's going to be different for everyone. Some people can make the distance work like Anna did. Others might find it easier to just move their adult GI, move to an adult GI when they start college or when they start a new job in a new area, just due to the geography of these things.
All right, thank you, Aliyah. And actually, we have another question for our NCCL members, and we will start with Rahm. And the question is, any advice on how to stay organized regarding appointments / care on top of everything else going on as a student?
Yeah, I guess I think one thing that's been super helpful with being organized and having access to help, like our healthcare teams, is just the fact that there's a patient portal now with like things like MyChart, where you can just message your doctor and you can see your appointments on the MyChart page, and then you can just like import it to your calendar. So those things have been helpful. But just like, I guess, taking healthcare as a priority and like being on top of that has just been helpful for me. I think I always think about my health before my school now. And so like, I'm very focused on going to appointments and getting your medications and stuff like on that on time. But yeah.
Right, Aliyah or Anna, do you have any other insight on this?
Yeah.
I definitely am not great at this.
Oh, you can go, Leah.
So. Oh, thanks, Anna. But I find, you know, making calendar reminders helps me. You know, if as soon as I refill a medication, I say, okay, how long is it going to last? Set a reminder in my calendar so it'll pop up and tell me, oh, you're going to run out in the next week. You should order a refill. But it's definitely a lot of work, especially if you take a lot of medications. The infusions are a little bit easier if that's all you take, because oftentimes the doctor will call you to schedule those. But you know, I have an inhaler that I take every day and I always run out of it. Yeah, so I have not found the perfect way. I think if people just need to experiment to see what works for them. But the only thing that I found that really works is calendar reminders.
Thank you, Leah.
Yeah, I
go
shared
ahead,
Google Calendar with my mom because we were getting into fights about scheduling conflicts. So now if whoever gets to the calendar first on the Google Calendar. And medicine, this is like the coolest thing I have is a medical ID bracelet. There's a QR code. So if someone needs to use it like a paramedic, they just scan it with their phone, like camera, and you connect it to an app. So you list all your medical information, all your medicine. So I just keep that up to date and it's always on me. So yeah.
All right, thank you all. We'll go next to Dr. Michael. A question for you. How do you as a pediatric GI work with your patient's new adult GI to collaborate on care?
That's a great question. So in a few different ways, the first way is to help young adults and their families choose what I hope and think will be the best adult GI for them. And so as a brief segue, people might wonder, well, how do you find a good adult GI? I would encourage you to talk to your pediatrician because while it might be surprising, the IBD world is small. And so if Adam was my patient, he said, Dr. Michael, who should I reach out to in Iowa, who's an adult GI doc? I would go into my connections and find out from my other IBD colleagues who the best adult GIs are who take care of folks with IBD in Iowa. So please, don't be afraid to ask your pediatric providers and teams, who would you recommend in this area? So that's the first way we collaborate, is setting you up for success by helping you pick someone who we think is going to fit with you. And then the second way is that depending on where you're at, some folks will actually help create a IBD health summary. So it's almost like a transfer letter that says, you know, Rahm is such and such a year old. He was diagnosed at this time. Here's the medicines he's been on and what's worked and what hasn't worked. His last scope showed this, his last lab showed this. You know, here you go. And so that's something else you can ask your healthcare team in the pediatric setting to help you with. You know, help me get those records. Help me make sure that I'm not going to roll into this adult office and they have nothing, because that's really frustrating and probably scary, because we all know how complicated IBD can be, and you know, putting it all on you as a young person or all on your family to remember all of the details of your care is not fair, and it is not the best way to do it. And then sometimes, you know, some patients have had a relatively simple journey. You know, they got diagnosed, they've been on one medicine, their letter is short, you send it to the adult doc, and you're not really worried about things getting kind of falling through the cracks. But some people, and I know, again, I'm preaching to the choir here, have had really complicated courses, have been on lots of medicines, maybe had some surgeries. And in those scenarios, picking up the good old phone and talking to the adult doctor can be really helpful to do kind of what we call a warm handoff, talking to that person one-on-one to make sure they know how to help take care of you on the adult side.
All right, thank you, Dr. Michael. Do we have another question for our NCCL members? How do you manage new support services on campus or at a new job? And why don't we start with you, Aliyah?
Yeah, so unfortunately, this can be different everywhere. You know, as a council, we've been trying to produce resources for how to get accommodations in college, but it really depends on the college, and it can depend on your job as well. But in terms of college, they usually, if it's a public school, they'll usually have some sort of office of disability. Mine's called Disability Resources for Students. Other places call it different things. You're just gonna have to kind of figure that one out, hopefully. In your orientation and in tours, colleges will advertise it, but you kind of have to contact them. If they have a website, look up, you know, what they required to get accommodations. That doesn't always work. They said they wanted a letter from a doctor explaining it. That's what I sent them. I got denied. And so, you know, you really have to work with them. I find it helpful to just talk to them face to face. They're open year round because, you know, there are summer classes at colleges. So you can just go visit them. Well, you know, you couldn't during COVID, and I don't know if this is back open yet, but you could call and be like, hey, I'm a prospective student and I'd like to talk to you about what your accommodations look like. Accommodations can be a large variety of things. I have testing accommodations, so I get extended time on tests. I'm also in a reduced distraction environment, is what they call it. It's just essentially a private room where, you know, I'm proctored privately, so I can leave to use the restroom without disrupting other students, and my extra time doesn't cause a disruption to the rest of the class either. I find this really helpful because even when I'm not sick, you know, I do things to take care of my health, like always going to sleep on time. You know, I don't pull all-nighters studying like some of the other students might, and so I find, you know, I may not be studying as much as the other students, and so that extra time can also help me there, in addition to just lowering my overall stress during test times, which, you know, helps reduce the stress load on my disease. And accommodations can also look like absence accommodations. So if I need to miss class and there's a test that day, what happens? If I need to miss class and you're taking participation points, what happens? And so this just plans out. We fill out a form before the quarter starts, and we figure out, okay, if I'm absent on this day, what's going to happen? How do I make up that work? And so I find that having accommodations really just reduces the stress overall, because you're never like, oh, I really need to go to class because I don't want to miss this test. It's going to be really bad. But when you have accommodations in place, you can be like, it's okay if I have to miss it. I know what'll happen, and I know that it'll be okay. And I find that reassurance is really helpful. And I'll talk about jobs just a little bit too, because I know I'm one of the older people here. And so I've had a number of jobs. I luckily have not been too sick during jobs to where I've had to formally request accommodations. But I usually let my supervisor or an HR person know at the beginning when I start, and I say, hey, just let you know, I do have this disability. I usually disclose it when I'm applying to jobs. You know, they fill out a form, so often they reach out. But I'll say, hey, I have this disability. This may look like me having to take extra time off for doctor's appointments and things like that, because doctor's appointments can also be sick time. File your doctor appointment as sick time, not paid vacation leave. And so you have to, do these things to let them know. And so they can expect that you might be taking that more time off, and why. So, there's no miscommunication like, Aliyah always takes sick days, even though she's fine. But in reality, it's me leaving to go get my infusion. And so I find communication is really the best way to go about that.
Thank you, Aliyah. Gosh, I don't think I could have said that any better. You really hit all the different marks. I guess one thing I will add in is from my own personal experience, my family, when I was in high school, really made an effort to get a 504 plan in place for me. And that was an accommodations program in high school. I didn't necessarily need it completely at the time. However, based on what my parents had learned from my GI, as well as some other support from the Crohn's and Colitis Foundation, was that if you have an established 504 plan in high school, it's a lot easier to transform those accommodations to college and not have to go through the situation like Aliyah shared earlier of getting denied. So I would highly encourage any high school students or parents of high school or middle school students to do a little bit of research into their state's program for a 504 plan to see if that would be appropriate for your child, especially if they're looking to go into higher education, because it's a lot easier to transfer that than it would be to completely start from scratch. So
Adam,
I guess,
I'm so sorry. May I have a few other comments on that? Just little tidbits.
Yes, of course.
So one thing I'll say is that, and I think Adam kind of just alluded to it too, that if you're feeling well, whether you're still in high school or in college, I've had many different families and patients say, well, I don't need disability accommodations. I'm doing good. Like I'm fine. I'm on oral meds or whatever it may be. Think of it like an insurance plan. I hope that you will never, ever have to use your disability accommodations. That would be lovely. However, you might, and it would be so much better to have those ready. And I actually loved, Aliyah, you highlighted some beautiful additional benefits that people might not think about. Even if you're feeling good, like you said, maybe it's going to protect your sleep. Maybe it's going to protect your mental health, which we know is so closely tied to your gut health. Maybe it's going to, I don't know. There are infinite ways that it can help you, and I think it really can't hurt. So I would encourage you to do all the wonderful things that our group is sharing. And the other thing I'll say for work accommodations is when you're interviewing for jobs, you do not have to disclose that you have IBD. And legally, people are not allowed to discriminate against you for having IBD. However, it might be hard for someone to prove that someone has discriminated against you for having IBD. So I would recommend, it's a little bit of this is much more pessimistic than my usual self, but I would recommend not sharing it at the beginning. And then when you get the job, asking for those accommodations or disclosing as you feel comfortable. I don't know if our other collegiate members have thoughts or comments on that, but those are my little added tidbits.
Yes, thank you very much, Dr. Michael. And as someone who has been discriminated in the workplace because of my disability, that's something that's very important to keep in mind. And thank you for sharing that. And now we're going to kick it over to Rahm and Anna. We'll start off with Rahm. Could you maybe provide us, while we're on the subject of accommodations, a little bit more about dorm room accommodations or within the residence halls, if you had any?
Yeah, for sure. Unfortunately, at Boston University, I was able to get in touch with the accommodations, the disability services here, and I got an individual who's like my disability advisor, and she was able to get everything to work well around this. And so I guess she told me to get a letter from my doctor saying all the stuff I need, and what my doctor told me to do was just fill it out myself, and she will sign off on whatever I needed. And so I was like, I need a restroom, like a low density restroom. And then I think that was like the biggest thing that I guess needed. And I was able to work that out. And so, yeah, it was pretty smooth on my end. Yeah.
Yeah, so I went through disability services as well. I made sure that this was like set and guaranteed before I would commit when I was like putting down the deposit. I was like, no, I need this to be sure. I needed a bathroom in my own room. Like that was kind of a deal breaker for me if I couldn't have that. So I actually we have apartments as part of our housing on campus. So I have my own studio apartment. So bathroom, kitchen, and bedroom. It's really nice too. The kitchen is a bonus because it's hard for me to find things that I can eat here. So that was an added bonus that I didn't even think of really. Yeah.
All right, thank you, Anna and Rahm. So as we are reaching the end of our time here, we will have one final question. We're going to start with Dr. Michael and then go to Aliyah, then Anna, then Rahm, then myself. The question here is, what's one piece of advice that you have for teens with IBD who are looking for what college to attend or the next steps after high school as they enter young adulthood?
That's a fabulous question. I would say my biggest piece of advice is to reflect on what you really want to do and what makes you excited and passionate and what you want the next step of your life to be. And then lean on your supports, your family, your friends, your medical team to help you get there. I loved Anna's kind of like, well, I went to California because people didn't think I could. And so I did it, right? So we are here to get you where you want to go. And there are ways to make that happen by planning ahead and by getting creative.
Yeah, no, I definitely agree with that. I think, as IBD patients, we're really capable of anything. So I don't want you to think in terms of, oh, I shouldn't go to that school. It's a little bit too far away from my doctor's office, from my parents. If that's what you want, you can make it work. You've heard very different stories from each of us tonight, and we've all made what we wanted work. And so I would say that don't try to put barriers to your success by thinking that you can't do it. You can always try, and if it takes you longer than 4 years or 2 years, if you're doing an associate's program, that's fine. Lots of people that have been on this council in the past have taken gap years, gap semesters off. Just go at your own pace, and you should prioritize your health, but also don't limit yourself, is what I would say.
Yeah, so I guess my piece of advice would be find out about disability services when you're applying, not even like when you've been accepted. For me, it was really helpful to visit the schools and set up a meeting with disability services and sit down and really talk about, this is what I will need. Can you do it? And having that reassurance was very nice. And I go to a very small school. It's under 4,000 undergrads. So we also have that nice, like, it's small, they can give you more attention, pretty much. And yeah, so that would be my advice, I guess.
Yeah, I'll echo Aliyah in that anything is possible. You can do whatever you want, wherever you want to go, but it doesn't have to be the same way that other people do it. Like, healthy individuals will be doing it a different way. You might need to take more time. You might need to take a gap year. I didn't think I would be able to play a sport in college, but working with my nutritionist and my doctors, and really, I guess I don't do the same things that my teammates do, but I'm able to compete by just doing my own thing and just being focused on myself, but I'm still able to do the one thing I wanted to do. So yeah, just focus on yourself, but you can do whatever you want.
And the one last piece of advice I would give is to not be afraid to ask questions of your university, of your job, of your insurance program, of your doctors. Keep asking questions, because information is power, and knowing things is going to really help your care. So with that, I'd like to thank everyone here tonight. There was a lot of great information shared throughout this evening. Thank you to our expert faculty and panelists for sharing your knowledge and answering questions from our audience. For more information, we encourage you to check out the Crohn's and Colitis Foundation's website at crohnscolitisfoundation.org, where there are specific resources for children's, teens, young adults, and parents. You can also contact the IBD Help Center to talk to a specialist about any IBD-related needs at 1-888-MY-GUT-PAIN. Again, that is 1-888-MYGUT-PAIN. I want to remind everyone to please fill out the evaluation survey that will be sent to you after tonight's program. We really appreciate the feedback, and it will help us plan for future programming. Before we say goodnight, we would like to invite you to view the Foundation's upcoming My IBD Learning webinars and regional events at crohn'scolitisfoundation.org/myibdlearning. Thank you and have a great evening.